51. What should a nurse do if a patient is suspected of having a highly contagious infection? Answer: place the patient on isolation precautions. Explanation: isolation precautions, including appropriate PPE and room isolation, are essential to prevent the spread of highly contagious infections. 52. What is the primary reason for using personal protective equipment, PPE, in healthcare? Answer: to protect both healthcare workers and patients from infection. Explanation: PPE acts as a barrier to prevent the transmission of infectious agents between healthcare workers and patients. 53. How often should surfaces in patient rooms be cleaned in a hospital setting? Answer: at least daily and whenever visibly soiled. Explanation: surfaces should be cleaned regularly to prevent the accumulation of pathogens that could potentially be transferred to patients or healthcare workers. 54. What is the most effective method for preventing the spread of gastrointestinal infections? Answer: frequent hand hygiene and isolation of infected patients. Explanation: proper hand hygiene and isolating infected patients help reduce the transmission of gastrointestinal pathogens. 55. Which action is most important for a nurse to take when caring for a patient with a respiratory infection? Answer: wear a surgical mask when within 3 feet of the patient. Explanation: respiratory infections are transmitted through droplets, so wearing a surgical mask helps prevent their spread. 56. Which of the following actions is the nurse's priority when caring for a patient in contact isolation? Answer: donning gloves and a gown before entering the room. Explanation: contact isolation requires wearing appropriate PPE to protect against contamination from infected surfaces or bodily fluids. 57. A nurse is preparing to remove a contaminated gown. What is the proper order for removing PPE? Answer: gloves first, then gown. Explanation: gloves should be removed first to avoid contaminating the gown, and the gown should be removed carefully to avoid touching the outside of it. 58. What should be done if a nurse accidentally gets a blood splash in their eye? Answer: rinse the eye with water and report the incident. Explanation: immediate rinsing of the eye with water minimizes the risk of infection, and the incident must be reported for follow-up care. 59. What is the primary reason for using alcohol-based hand sanitizer in healthcare settings? Answer: to reduce the number of pathogens on hands when soap and water are not available. Explanation: alcohol-based hand sanitizers are effective in reducing microbial load on hands, especially when soap and water are unavailable. 60. When caring for a patient with a draining wound, which precaution should the nurse follow? Answer: use a face shield or goggles to protect from splashes. Explanation: protecting the eyes and face from splashes ensures the nurse does not come into contact with potentially infectious materials. 61. Which of the following is the best method for preventing the spread of influenza in a healthcare setting? Answer: administering the flu vaccine to staff and patients. Explanation: the flu vaccine helps prevent influenza outbreaks by reducing the spread of the virus in healthcare settings. 62. What should a nurse do when preparing to administer an injection to a patient with an infection? Answer: cleanse the site with an alcohol swab. Explanation: cleansing the injection site with an alcohol swab helps reduce the risk of introducing additional bacteria into the skin during the injection. 63. What type of personal protective equipment should be worn when caring for a patient with pneumonia? Answer: surgical mask, gloves, and gown. Explanation: a surgical mask helps prevent droplet transmission, and gloves and a gown protect against contact with secretions and body fluids. 64. A nurse is entering a room of a patient on airborne precautions. What PPE is required? Answer: N95 respirator, gloves, and gown. Explanation: airborne precautions require an N95 respirator to filter out small particles, along with gloves and gown for additional protection. 65. A nurse is caring for a patient with an active infection and is required to wear a gown. What should the nurse do after leaving the patient's room? Answer: remove the gown and gloves before exiting the room. Explanation: removing PPE before exiting the room helps prevent cross-contamination of the environment. 66. What is the most effective way to prevent healthcare-associated infections, HAIs, in the operating room? Answer: adhering to strict aseptic techniques during surgery. Explanation: aseptic techniques in the operating room minimize the introduction of infectious agents, preventing surgical site infections. 67. Which of the following is the most appropriate method for preventing the transmission of methicillin-resistant Staphylococcus aureus, MRSA? Answer: implementing contact precautions for affected patients. Explanation: MRSA spreads through direct contact, and contact precautions are necessary to prevent its transmission. 68. What is the first step in caring for a patient who has been exposed to a bloodborne pathogen? Answer: wash the exposed area with soap and water. Explanation: immediate washing with soap and water helps reduce the risk of infection after exposure to bloodborne pathogens. 69. What is the purpose of performing a surgical scrub before surgery? Answer: to reduce the number of microorganisms on the hands. Explanation: a surgical scrub is performed to reduce the microbial load on the hands and arms before performing a sterile procedure. 70. A nurse notices a red, swollen area on a patient's leg that is warm to the touch. What action should the nurse take? Answer: notify the physician and implement infection control measures. Explanation: a red, swollen area may indicate an infection, and timely intervention is necessary to prevent further spread. 71. A patient is placed on isolation due to a respiratory infection. What PPE should be used when entering the room? Answer: a surgical mask, gloves, and gown. Explanation: PPE, including a surgical mask and gloves, is required to protect against droplets and direct contact with respiratory secretions. 72. Which of the following is the most effective method for reducing the spread of infection when using a urinary catheter? Answer: follow proper sterile techniques during insertion and maintenance. Explanation: using sterile techniques during insertion and maintenance helps reduce the risk of catheter-associated urinary tract infections. 73. How often should a nurse wash their hands while caring for a patient with a contagious infection? Answer: before and after every patient interaction and after touching potentially contaminated surfaces. Explanation: frequent hand washing reduces the transmission of pathogens between patient interactions. 74. What is the primary method of infection prevention in a neonatal intensive care unit, NICU? Answer: strict adherence to hand hygiene and isolation precautions. Explanation: hand hygiene and isolation precautions help protect vulnerable neonates from infections in the NICU. 75. What type of precautions should be followed when caring for a patient with a known gastrointestinal infection? Answer: contact precautions. Explanation: contact precautions are necessary to prevent the spread of gastrointestinal pathogens through direct or indirect contact. 76. A nurse is preparing to care for a patient with an infection requiring droplet precautions. What PPE should be worn? Answer: surgical mask and gloves. Explanation: droplet precautions require a surgical mask to prevent respiratory droplets from reaching the healthcare worker, along with gloves for protection against contact. 77. What is the primary reason for isolating a patient with a contagious infection? Answer: to prevent the spread of the infection to other patients and healthcare workers. Explanation: isolation prevents infectious agents from spreading to others, reducing the risk of outbreaks in healthcare settings. 78. What should a nurse do if a patient on isolation precautions requests a visit from a family member? Answer: ensure the family member wears appropriate PPE and follows infection control protocols. Explanation: family members must adhere to the same infection control precautions as healthcare workers to avoid transmitting infection. 79. Which of the following should be done if a nurse is exposed to a patient's respiratory droplets? Answer: perform hand hygiene and monitor for symptoms. Explanation: hand hygiene helps reduce the risk of contamination, and monitoring for symptoms allows for timely intervention if an infection develops. 80. A patient with a contagious infection is being discharged from the hospital. What should the nurse ensure before discharge? Answer: provide instructions on how to prevent the spread of infection at home. Explanation: Educating patients on proper hygiene and isolation practices at home helps reduce the risk of spreading the infection to family members and others. 81. What action should a nurse take if a contaminated needle is found in a patient's room? Answer: immediately place the needle in a sharps container. Explanation: contaminated needles should be disposed of in a sharps container to prevent needle stick injuries and transmission of infections. 82. Which of the following is the most important action to prevent the spread of infection in a hospital setting? Answer: hand hygiene. Explanation: hand hygiene is the most effective method to reduce the transmission of infections in healthcare environments. 83. What is the most important action when caring for a patient with an active wound infection? Answer: use sterile technique when changing the dressing. Explanation: using sterile techniques when handling wound dressings helps prevent further contamination of the wound and reduces the risk of infection. 84. How should a nurse dispose of gloves after caring for a patient with a contagious infection? Answer: remove the gloves carefully and dispose of them in a designated waste container. Explanation: proper disposal of gloves helps reduce the risk of contamination and the spread of infectious agents. 85. What infection control practice should be followed when caring for a patient with an upper respiratory infection? Answer: place the patient in a private room with droplet precautions. Explanation: droplet precautions are necessary to prevent the spread of respiratory infections, including the use of a private room. 86. What is the purpose of wearing a face shield or goggles when caring for a patient with a contagious infection? Answer: to protect the eyes and face from splashes or droplets. Explanation: eye protection prevents droplets from entering the mucous membranes of the eyes and face, reducing the risk of infection. 87. What should be done if a nurse has a cut or open wound while caring for a patient with an infection? Answer: cover the wound with a waterproof bandage before providing care. Explanation: covering the wound with a waterproof bandage helps prevent exposure to pathogens while providing patient care. 88. What is the most effective infection control measure for preventing surgical site infections? Answer: administer prophylactic antibiotics as prescribed before surgery. Explanation: prophylactic antibiotics reduce the risk of bacterial infections after surgery, particularly in high-risk patients. 89. What is the best action to take when a nurse is about to perform a procedure on a patient with an active infection? Answer: ensure that the correct PPE is worn to prevent exposure to infectious agents. Explanation: wearing appropriate PPE is essential to prevent healthcare workers from being exposed to infectious agents during procedures. 90. When should a nurse use a surgical mask for infection control? Answer: when caring for a patient with a respiratory infection. Explanation: a surgical mask helps prevent the spread of respiratory droplets from the patient to the healthcare worker or environment. 91. A nurse notices that a patient's wound is draining a yellowish, foul-smelling fluid. What is the nurse's first action? Answer: report the wound drainage to the physician immediately. Explanation: a change in wound drainage, especially when it has a foul smell, may indicate infection and requires immediate medical assessment and intervention. 92. Which of the following is most important when caring for a patient with tuberculosis? Answer: wearing a fit-tested N95 respirator mask. Explanation: tuberculosis is transmitted via airborne droplets, so an N95 respirator is necessary to filter out small infectious particles. 93. A patient on isolation precautions requires a transport to another department. What should the nurse do? Answer: ensure the patient wears a mask and follow the isolation protocol during transport. Explanation: the patient should wear a mask to prevent droplet transmission, and isolation protocols must be adhered to for safe transport. 94. When removing gloves after patient care, what is the nurse's most important step? Answer: perform hand hygiene immediately after removing gloves. Explanation: hand hygiene is essential to remove any potential pathogens that may have been transferred to the hands from the outside of the gloves. 95. Which of the following should be done before preparing a sterile field for a procedure? Answer: perform hand hygiene. Explanation: Hand hygiene is essential before setting up a sterile field to reduce the risk of contaminating the sterile environment. 96. What should a nurse do if they are exposed to a needle stick injury while caring for a patient with a known infection? Answer: immediately clean the wound with soap and water and report the incident. Explanation: prompt cleaning and reporting are crucial to minimize the risk of infection transmission from a needle stick injury. 97. A nurse is caring for a patient who has C. difficile. What type of precautions should be implemented? Answer: contact precautions. Explanation: C. difficile is spread via spores through direct or indirect contact, requiring the use of contact precautions to prevent transmission. 98. What is the primary purpose of using a dedicated equipment, e.g., thermometer, for each patient in isolation? Answer: to prevent cross-contamination between patients. Explanation: using dedicated equipment for each patient helps prevent the transmission of pathogens that may be present on the equipment. 99. What is the best way to prevent the spread of infection in a hospital room with a patient who has an open wound? Answer: maintain sterile technique when dressing the wound. Explanation: sterile technique minimizes the risk of introducing additional pathogens into an open wound, reducing the risk of infection. 100. What should a nurse do when they are about to administer medications to a patient in isolation? Answer: wear gloves and follow isolation protocols for the patient's condition. Explanation: wearing gloves and adhering to isolation protocols help prevent the transmission of infection during medication administration.